Welcome to our interview series from the Community of Practice for Global Health R&D, a joint initiative between the Global Health Center at the Geneva Graduate Institute and the United Efforts for Innovation, Access and Delivery. Today, we spotlight EspeRare Foundation, a not-for-profit organization based in Geneva, Switzerland, dedicated to developing treatments for rare diseases in children. EspeRare fills critical gaps by merging scientific expertise, patient advocacy, and collaborative partnerships to improve access for underserved patients. We spoke with Caroline Kant, Executive Director, and Sebastian Matsuri, Prenatal Platform Development Director, to learn about EspeRare's collaborative approach. EspeRare is based in Geneva, a global hub for health policy and innovation. In this video, we discuss how this strategic location fosters collaboration, forming strong partnerships, and ensuring patient groups remain central to its mission.
EspeRare is actually uniquely positioned in Geneva because we can leverage the status of this city as a global hub in terms of influencing policymaking and also global health innovation. In terms of truly exploring the power of collaboration and also aligning purpose around not only advancing innovation for rare disease in the sense that we need to innovate in a way that will balance this challenge of developing sustainable models for a few patients in the world, and also developing a model that aims at accessible and equitable development of treatment. So my belief, and this is what we have experienced and adapted over the decade that EspeRare has been created, is that the more we leverage on complementary strengths of key stakeholders, and in EspeRare's model, it's all about bridging the patient organizations, activities with academia that understand best how to tackle these diseases, bridging to making the drug we develop attractable for commercial partners, and then also influencing the policies and regulatory and accessible programs, so that we make sure that when we start this innovation, we take the responsibility down the line that this treatment will benefit the patient that should access them globally. Being based in Geneva, on one hand, in terms of evolving and refining the impact of our model, we had the opportunity to not reinvent the wheel, but on the contrary, to learn from models such as private-public partnership models that have been successfully developed in the neglected disease space, and being able to adapt it and tailor it to the specific challenge of rare diseases. And this proximity, for example, with Medicine for Malaria Venture, for example, where we could exchange ideas and learn from what have worked and not worked in this specific domain, and then adapting it to our rare disease specific context, has really been priceless. And I have to say, the proximity of these exchanges was really a driving force to adapt the collaborative model. We develop treatments for rare disease on a global level. Obviously, there's also the complementarity of building strong partnership with key regulators such as the FDA in the US and the EMEA, such as the most advanced experts in the rare disease we tackle. And so we have to find academic partners around the world where there is these biomedical experts that are at the forefront of research in the rare disease we tackle. What we leverage is also international patient alliance that really think to tackle the needs of a particular rare disease on an international level. And that's very interesting, and a specificity in rare disease where you have local patient organizations, but most often they regroup themselves as a patient alliance that are really trying to develop awareness, develops the tools to ambition to develop life-changing treatments for these treatments. And they are really, at an international level, our key partner to advocate and also to prioritize our activities to make sure that we fund and we drive the proper research and development that will be the most impactful.